Hello, Honors program. I'm back with my 8th day of clinical apprenticeship. You can see I'm in my house again. I had another day of relative darkness. I got out a little earlier today than I did last time mostly because I didn't have to do any lidocaine injections or biopsies or anything like that. It was a little bit slower day. I got a tripod. If you notice my little steadier hand, it's because it's not in my hand at all. It's the tripod. As I said, today was a slower day than before, but that doesn't mean it was any less interesting. I still learned a lot. We had a well child visit. It was just a 1-year-old or 12-month-old, which I don't have as much practice with, obviously, as the adults. So that was good. That was good practice for me. But the most interesting case of the day was a 47-year-old male who was just in there for a physical, just a yearly checkup kind of thing. But he had a couple of complaints. He was having it was his right third digit, so his middle finger, the DIP joint. He was having some pains, and it was really like inconsistent. It was just kind of like, or infrequent, I guess. It was kind of just once every month or so for the last 6 months. It would last a day or two, and then it kind of goes away on its own. He said he wasn't big on taking medications or even like over-the-counter stuff. So he kind of just like dealt with it, and then it would go away eventually. He mentioned that his dad was recently diagnosed with rheumatoid arthritis like 5 years ago. So he was wondering if that was the same thing that he was experiencing. He also complained of like some mid-thoracic, midline kind of back pain. He said it doesn't radiate anywhere, like it doesn't radiate down his spine or up his spine or to the sides. And he said he's been having it for like 1.5 to 2 years at night. It's been waking him up at night sometimes, like with pain, and he'd have to get up and move around a little bit. And within the last 6 to 9 months, he noticed it was kind of present during the day. And he didn't describe it as a pain necessarily. He said it was more kind of discomfort and tightness. He said it's just there. That was his quote. And he said like movement didn't really help or hurt it necessarily. Like he still had full range of motion of his back. So starting with the finger, my preceptor thought that it probably wasn't rheumatoid arthritis, because he said rheumatoid arthritis is extremely symmetrical. So he said like if it's in this digit, it's also going to be in the same hand, or the other hand's same digit. Wherever the arthritis is, it's likely in the same exact spot on the other side. So he said it's probably not rheumatoid arthritis. He mentioned that it's probably either osteoarthritis, which is more generalized kind of breakdown of the bone and of the joints, or it could be possibly, and he thought this was less likely than the osteoarthritis, but it could be gout. And gout is something that's associated with uric acid buildup. That was a little bit less likely, but it was still in the differential, among other things. And then for the back pain, he mentioned that it was probably a muscle spasm he was having. The presence that he was feeling during the day was just kind of muscle tightness. And then what was probably waking him up at night was muscle spasms, just of the paraspinal musculature. So my preceptor just recommended some exercises to do at home, just kind of like physical therapy type exercises. He said if it continues or if it gets worse, he'll be happy to refer the patient to physical therapy. And for the finger, he just told the patient just kind of watch it. If it really continues or if it starts to get worse and starts to be more bothersome, they can definitely do some more testing. We could test the blood for uric acid levels, see if that is elevated. If so, it's probably gout. Or we could even take some imaging, like a simple X-ray or something of the hand, and see if there's significant like breakdown in that joint specifically. And that could clue us into osteoarthritis. But for now, it's just kind of a wait and see approach. So, like I said, a little slower day, I guess, on as far as eventful things, but it was nonetheless informative, and I felt like I learned a lot. I got to practice, again, my physical exam on a well child, just a 1-year-old, so that was nice. And I hope you guys enjoyed. I will see you guys. I have a couple weeks off here because we have exam weeks coming up, but I'll be back whenever I return to clinic.